rainy and cloudy Saturday here in Accra, but as Senya Debia, we associate rains with showers of blessings. And so if you have tuned in to this channel, then you have tuned in to the right time, because you are going to be blessed. There's SWTV consulting room now. WTV consulting room. Debia mekase we ena ege the only consulting room yenju sika eye free, because oko hospital oko doctor consulting room ye beju sika enti midi ede 𝗟𝗓𝗩𝗪𝗓𝗍 ahenende mitnemu ama eye ye sister ye maame ya de nyina eye osofo Rose Aduful enti yende me ena midi jumedie ihu chiame enti mesesa channel no, because today you are going to discover valuable insights about your health. Ye try ho abasisia na meyi eye yen sister ye no eba betwetwe enkomo no achiro.
Therefore, ade achen bio ye call ye na so ye kodai ye rade adom nti ye nyina ya sorry emofra akọ omusuku edwumanfo so kọ omunyuma so se wo son da yo se wan son da yo ye ka kire sorry na shrey sorry na shrey dwumadie ya no kwabosu dwumadie bi a ye de bre yen se de be ya ye betimi enyini ewo hunhu na yenyi ohunamu na mpo etimi yenyini ewo adwene mu se de be ya yenyina betimi akyekere man na ya kyekere asafo na afie kra yetimi akyekere busua
ye behwe ensem a ekoso wo oman Ghana eni wiase afa na nyina
ye befa ensemi efiko wankrata mu ene abefo internet so
anape bia ye ensem a ema enidaso eni insatwaye ebebre ye de onyankopon asem bebre na ya hweso e de aboye bra afa kan ye hu anape bia na ye mfa enije nsem embre
enenti afa kan ye ho
Anita Kwabo
ene Reverend 𝗟𝗓𝗪𝗘 ewo Wesleyan TV so afa obetimi ahwe won WTV Ghana ewo Facebook so na afa Wesleyan TV Ghana ewo YouTube so sorry na sharing
wake up to a purposeful day.
Jumadie aboafo bi te se
All Insurance, multi-credit savings and loans.
ana Methodist University Ghana ana aso yasen
Yen church Jumadie Sronko Methodist Yahye ede ebrem yen church so ye besua ade afa de enim efa Nyankopon ho Yesu Kristo honhom kronkron ene sane yetu ye gidie mu anamo ebe pensem ye gidie no fapem yen church ye bebisa ye besua na ye behu kan ye ho na yen sua de ewo yen church so yen church ye ma gidie no mu ada ho pefe.
Yedase Yasain Atnasi Biom. We want to apologize for the late start of the program. It was due to a technical challenge. Na yenim se WTV ashafode de bia moye emano eyefe enti WTV consulting room ena uhwe mitnemu ama yen sister osofo Rose Aduful and yen topic ye discussing no family planning. We are discussing family planning, and so yewo nimdifo bi ewo ha ewo studio ha na menidin ede sister Frederica Cranchin or your senior midwife ewo reproductive health unit Korle Bu Teaching Hospital. You're welcome.
Thank you.
Inti say reproductive health unit a dear bang sa potena moyo.
Okay, so reproductive health is just everything woman reproductive health.
Okay. Inti yeka family planning, yeka issues affect emba yase any ya wudie mu aha. Inti ye ma minimo mu ye do menopause, they tend to have problems before that and then even during that, and then sexually transmitted infections. Yeah, sure, no, and people who are trying to get pregnant, not just family planning, but are more power also. And for some reason, those who say and they have issues, we see them as well. And yankola na almost here at church and efa daily lifestyle and reproductive health also sure more.
Okay. Enti ashefo when you na crache say yenya nimdifo ewo yen studio has say enti no ye de enkomo no ebe hihye so ye ka say family planning edien na eye family planning.
Okay, so family planning there, it's basically how our plan with family. So the measures you put in place to decide when you want to have a child and when you don't want to have a child.
But at least nanka debia yekase enkolade omo ye achedie efri nyankopon. Children are gifts from God, and it's beautiful to have children. Enti nanka wosha anka aden na ehu ebehia say yebeye family planning. Yes. I say achedie na nyankopon we de ema no o mpebisa ana.
Okay. Enti yes, but why not? Obeka say, "Nyame acheme ade inti." Okay, I'll keep receiving. Eba, then you don't do anything about it. You are giving birth to like 15 children at a time. So osha Oni ukunu no mabrabo masitine mo a muntumi nhwe san kola na mo wo no. You see, even though nyame ema ya chede no wasama ye nyansa se ne be ya ye de be hwe ye ho ye de aboye bra ene se na ye be live your life. So then there's that wisdom to decide that God, with all that you have blessed me with, I can take care of 3 children. So I want just 3 children. Yes, it's a blessing, but at the end of the day, it's what you can handle. Yes, nyame na hwe nkola, of course, but at the end of the day, what state are the nkolanu going to be in before they grow up? All that matters, and all that comes into place when we are thinking about family planning.
Okay, so basically the essence of family planning, NSA, yeah, share, yeah, asitnim, whether it is like we need those children at that particular point in time.
Exactly.
Okay. And you know, yeah, family planning, what are the various types, the forms of family planning?
So family planning in India, we have a lot of the types. Okay. Yeah, well, the natural, yeah, well, the artificial. So
I mean, is the first time I made to say your natural family planning?
Yeah, natural family planning. Okay. Even coming back to a question I will be saying, yes, even though nyame sa kwan say to me there is still the natural way of preventing the pregnancy without making it look like ubu nyame mas.
Okay. What are some of the natural ways of family planning?
So you can natural family planning now. It's more about whether unimo cycle. You can cycle from the first day of your menses to the last day before your next menses. Okay, that's one cycle. So some people can have 28-day cycle. Some people can have 30. Some people can have 35. And yeah, like a constant figure for most people is usually a range. So when you cycle now, then it helps you to be able to figure out when you ovulate. Ovulation is a time I will to nkosia. Nkosia na wo to nene betumi ama wenyi nsɛn no.
Okay.
In time I will to nkosia no eno na ye de hwe say ye be sex at this time ana say ye be twen so kakra say na be anyi nsɛn nkoba. Inti ni nyina is based on no cycle.
Okay.
Inti yaka types of the natural family planning na ye wo the calendar method. So calendar no eno no woni mu cycle no ye share how many days from the first day of menses.
Okay.
Yebeka say okay, we are free within this period till
time I will be ovulate. I Rebecca so this time the oil sex I'll be meaning saying till time I'll be your menses.
Okay, okay, say we free
We free. I said during that period no oil sex I won't say.
Now obey then who say this is my free or safe period.
And no ne adeba kwa ye chair where ho. And then natural family planning.
Okay.
But like I said, it depends on woman's cycle. So when you cycle, like, it will be very easy to know when you are safe and when you are not safe.
Okay, so then let's take it say obi a 28 days cycle. And na say or menstruate 3 days. Okay,
Yes.
okay, ode you find and say or menstruate 5 days at a 28 days cycle. Obi sano safe period no.
Okay. Until from the first day of the menses till like the 7th or 8th day of the menses,
Okay.
no, or you're free. From that time till the 16th day of the menses, or no, up to the 19th day of the menses, she's not safe.
Okay, so
we are counting Nina from the first day of the menses. Until first day of the menses near day 1.
it is say 1st July day 1.
Near day 1. Until from 1st July up to like 7th July, no, where you're safe. Until bleeding 5 days now. She has 6th and 7th July.
So if I understand what you are saying, even if the person is menstruating and the person still have sex during the menstruation, it's the person is not going to get pregnant.
I get your question. So with a 28-day cycle, it's not likely.
Okay.
But somebody who has a cycle shorter, like a 25-day cycle, a 21-day cycle, that one they can still ovulate even when they are menstruating.
Okay. Okay. So so all what you are saying, per my understanding, meaning that within the 28 days or 25 days, there's a time that is safe.
Yes.
That if you have sex around that time, you are practicing the natural method of the family planning. But Debisa, what if your cycle is not accurate?
So that's why I said that most people don't have like a fixed day cycle every month.
Okay.
It's usually a range. Okay, so some people can have their cycle between 26 to say 31 days or 32 days or even 35 days. It can be between that. Some people can have their cycle just between 28 and 30 days.
Okay.
And to say if cycle no is not regular, as in very far apart or very long, and also no, there's a different way by which we calculate the safe and then unsafe period.
Okay.
Nina using the calendar.
Okay. Enti mefasa akwenye so akase, just like you said that if someone comes to your unit at Kolebu, you can have time with a person. Now what you're trying to say, this is your safe time or this is your safe period. But Nancy, so me who say I say your phone apps and so and also it to me a boyma and crofo and who say okay, this is my safe period. And I say it's not advisable for us to be using the apps on the period calendar apps.
So apps no also uses your cycle.
Okay.
And it would actually work best if you know your cycle. And having to know your cycle, it means say one monitor cycle no, for at least a period of 6 months. Until every month, all your menses are first day you record. Following month, we'll be recorded. At the end of the 6 months, no, we are counting how many days in between each time you had your menses.
Okay.
And then a who cycle. No.
Okay.
So all these apps now, we use for the cycle now, when you are safe and when you are not safe. No. It is based on your cycle.
Okay.
Because anytime you are registering and you input, you have to input when you start your, like when your cycle is, like how long your cycle is, sorry. So if you input it in it, then it gives you a prediction of when you are safe and when you are not. Okay. As time goes on and you are inputting menses no, then it keeps track of what cycle no for you, and then it tends to give you a more accurate prediction as time goes on. But initially, you should be able to know so that you input what you know in it.
Okay. Entino ashefo se uye obia opese much about the natural family planning method you having sex during your safe period. Obetumi ako Kolebu Teaching Hospital reproductive health unit, right? Na wonom ebema wo inchenchum. Entino twaso apart from the safe time, no, which other natural method again do we have for the family planning?
So the natural methods needed, we have quite a number. But natural family planning methods are not as effective as using the artificial methods. Usually it's based on your body's reaction at a certain time. So another method I friend know the temperature method. So the temperature method, you are recording your temperature every day. During ovulation, your temperature goes up. So you are taking note of your temperature every day. Then when you notice an increase in your temperature, you avoid sex for that period, for like 2 or 3 days during that period that you notice the increase in temperature. But you see, that one too is not very effective in the sense that temperature sometimes even the change in the weather affects your body temperature.
Even change in environment.
There's another one that uses cervical mucus. Cervical mucus near insua ewayase. So at every time of the cycle, insua no one the texture. Until don't sasha wase and no insua no the texture. And whether you are safe or not. So during the time that you are safe, it is dry. It is dry. But during the time that you are ovulating, a very slimy, like I say egg white, and a bit like stretchy. That one means that you are ovulating. So you have to avoid sex during that period. Even that one, sukra one limitations, because when you have infections, how will you be able to tell what kind of discharges you're having at that time? And then one thing that we are also worried about is the fact, say, when you have sex, sperms stay in the tubes for up to 5 days before it's absorbed into the body. So during that 5 days, it is waiting for the egg to release at any time. And to say, if we are using some of these ones, now say we'll only avoid sex when we are ovulating. How about the sex we had like 2 or 3 days ago, when the sperms are already waiting for the eggs?
Now let me come back to what I wanted us to move on to the artificial methods, but you just made mention of something that is interesting. We'll say when you have sex, it takes about 5 days. No, repeat that that again.
What I said was, when you have sex, the egg being released stays only 24 hours before it's absorbed into the body.
When you have sex,
when you ovulate, the egg being released, just stays in the tube for 24 hours. But when you have sex, the sperms that are released inside stays in the womb for up to 5 days before they are absorbed into the body.
And what can you treat my
It is a obane be me share. Bema no hu nsuo no eche e wo ba na wodi anim
for 5 days.
And son a body no absorb it no hu nsuo no. Inti se eno no sa no se ye hwe body temperature ana se cervical mucus na ye hwe se time a ubehu ensisan no at that time no na che se wo tunkosua ana wa tunkosua dada. Ohono na ode be avoid the sex no. But so why a sex dada? Then there is the risk of getting pregnant because say bema no hunsuo no eguso wa wodi enim e twen kosua na by the time ebeto no say ni betumi esi at that time.
Okay.
Inti natural no bebre na e failure mo. Especially say cycle ne sisan kakra pe etumi failure mo.
Okay. Okay. Inti the misconception, any myth about if you have sex, if you go to the toilets, everything, all the sperms will come out. At the end, misconceptions and are not true. And I say,
so and all that's like you said, misconceptions.
Okay.
But enyampa.
Okay. Inti ashefo we de masuma enye ampa. Inti ye toaswa. What are some of the artificial methods of family planning?
Okay, it's artificial methods we have quite a number.
Okay.
And on my end is such that obia benya nide.
Okay, oka say obia benya
yes, obia benya nide in the sense say ex no obia ne nia ope say ye can family planning na.
Okay.
Ex no obia ne nia ope.
Okay.
And we have all these methods so that say a band say ebia when you saw a particular method and you're not comfortable with what you experience or you're not comfortable using that method, you can always switch and use a different one. Because ni now send a juma ni effect albinya.
Okay.
Okay. So ye pills. So pills no, there were two types.
Okay.
So ye were near a draw back up a womb, and ye one ye draw mienu a womb.
Okay.
So near draw back up a womb no is best for a ma or mumma nufo.
Breastfeeding mothers who want
mumma nufunsio. I am a mumma nufunsio.
Okay.
So breastfeeding mothers who are doing exclusive breastfeeding and their babies are still less than 6 months.
Okay.
And only near draw back up a womb no.
Okay.
That's the best option for them.
Okay.
And when they obia to me use obia so far as you don't want to get pregnant and you're comfortable taking a pill, you can use this one.
Okay. Obia meaning say obane bema.
No, I mean all these ones so far and bad. Okay. The only one here bema de condoms.
Okay, we will come to that.
Yes, into ye condoms if you money can you and bad.
Okay. Okay. So then what's it way no ewo mienu?
Yes, a draw mienu and a womb.
Okay.
But we a draw back up and a womb.
Okay.
And a draw back up and a womb because the second a draw na way muno say obi air breastfeeding na se offer a breast milk na se.
Okay.
So that is why we don't give this one to breastfeeding mothers.
Okay.
But this one is for everybody.
Okay.
Good. And pills no is such that I was so fun every single day at the same time.
Wow.
At the same time every single day.
Okay. Ain't you know if say obi fabia 12 in the afternoon I was say offer and was say 12 no every day
at 12.
Ain't you say bia that could be na say bia with two kwan na ni we fina say one fan kwa. Is it going to have any effect?
So we know say there are a lot of human errors. There are a lot of chances where you forget. They made provisions for if you happen to forget in the next few hours when you remember. It was a offer. Okay. If for any reason, maybe in a particular day, I was so far away if you want for. As soon as you remember, and I say, I did just now, I say, and rather man for immediately you have to take it. But we fee at so 2 days or more, it may fail you.
So it shouldn't be more than 24 hours.
Yes.
48 hours air cordial.
It may fail you.
Okay.
It may fail you.
Okay.
Until when you say no, oh, you'll be to send me now won't pay drofa. That's one. And I say, if you are then pills is not good for you.
Okay.
Because if you keep forgetting to take a pill, you can get pregnant.
Okay. So if pills is not good for you, then what is the next option?
So we have the injections.
Wow.
Injections, and so we have 2 of them. So this is for 3 months. This is for 1 month.
3 months, 1 month. Okay.
So on my end is such that, well, as no be any time or person or the train And also a person or the separate
number. Okay.
So if ebia as at now, you find so be a wawari for no for so person be trained by 6 months and son my faith. You can do the 3 months injection and no 2 injections is okay.
Ain't no and no meaning say every 3 months no obeba hospital abewo injection.
Yes.
Okay.
And now they have actually done a new one that you don't even have to come to the hospital to take the injection. Wait, one gets over to their wall. Mine is so cute, and the needle only you can see it. It's
okay.
So it's very easy to give yourself the injection if you want, so that you don't have to go to the hospital every 3 months.
I will even advise that your husband should do it for you. Abi, it's family
like if your
planning.
husband is not one who is confident enough.
Okay. Until with the 1 month, dear, no, meaning say every month be
and also every month be our injection.
Okay.
And also has the same 2 medications like this one. Into ways so breastfeeding mothers cannot use.
Oh, okay. Okay.
Yes.
Okay.
Yes.
Okay.
But otherwise, this one, every woman. So every woman in her reproductive age, every woman who can get pregnant can use this one.
Okay. So we have even 15-year-olds getting pregnant.
Yes.
And so meaning
they can all use it.
Okay. Okay. Inti say we obia wa pills umpe.
Mr. injection.
Okay. But we still don't encourage that for young girls 15 years and above. No. Because it's a Christian channel.
Yeah, that one is true. It's true.
Enti say we obia wa pills no umpe. Also so our injection umpe. So what is the next option for you?
Okay. Inti to say me and see a Mr. injection saying I won't do the injection.
Wow. Who show pills? Who sounds
show pill from Mr. injections.
Okay.
Inti me met me anyway. So we know you were 2 types. You were barcode that lasts for 3 years. And another one that lasts for 5 years.
It looks like matches, Anna.
Let me.
Okay, let me have a few of it. Okay.
So it's just plastic, rubber.
I said rubber tie.
Yes.
Okay.
Yes. So you share barcode for 3 years. You share mienu for 5 years. So you decide which one you want to do depending on how long you want to space your birth.
And no nidini then.
Any implant.
Implant.
Yes.
Okay. Into implant no. And no obeshen way fa.
And only a shower answer.
Okay.
So it goes under the skin on the arm. Okay. And you shower this side so that any idea will be behu. Because baby I want and yet the sha it's not obvious. Just all those saka and son of say so then you still get some privacy if you don't want anyone to know say why family planning.
Meaning say no you surgery
no, it's not a surgery.
Okay.
Where it comes with its own special needle. A panier any day.
Okay.
A panier keke.
Okay.
Any edition. So panier no is such that this one fits into it. Ketwasa. But before I idea na no. You want injection like a form of anesthesia. Send a bear or honey in our bill. Until you the shower won't tell you. What's I say?
Okay.
Until you the shower and
okay.
And it doesn't leave a scar because a panny near the ashe. Ye try and pam me ye horse baby. Ye de panny any day film with the ashe.
Okay.
And this one too is such that any time you are ready to have a child, until you find it's a 3 years, and then after like 2 years, you think that I think I'm ready. You don't have to wait for the 3 years. Watch your 5 years. Now after like 2 or 3 years or 4 years, you think it's enough. Me banning you don't person me won't each year. What's me about baby?
Okay. Interesting. No either 1 year dear and
no 3 years or 5 years.
3 years or 5 years.
Yes, 3 years or 5 years.
Okay. Inti asha for WTV consulting room so and now today we are discussing family planning. Nimdifo or aha I guess sister Frederica wacheche enyoma bebre. So far wacheche say family planning we have the natural one and we have the artificial one. Natural ones
ones no ebi any say you not having sex during your safe period and afe so you can say your artificial ones ni be pills be injection with the pills no they have some for breastfeeding mothers and you will be so no breastfeeding mothers and fa uye obi so usho edro no ma there's another option for you omo injection no so no ebi ewo ho no ma wankasa ubetumi awo ewo fie anaso say ubetumi akọ ayaresabia ama wonom ede awo afi yen komo twetwe no yedu implants so wonom ewo another method eno implants ubetumi ahye eno 3 years and 5 years but I say wo hye no 3 years no na ebia after 2 years o drink say oh me pese me wo me ba no echi ana say me pese me wa 3 years no do ya na 5 years no do ya but still no ubetumi akoyi enti me gidi ye pa say more questions to ask emmepemu no ye bebie phone lines no ubetumi so asende wo messages no aba na ye bekenkan ama sister enso ewo ahase questions bia ofra obebisa no obeyi ano ama kama enti no ye to apart from the implant no which other method again is available?
So yewo way IUD intrauterine contraceptive device.
Come again.
Intrauterine contraceptive device.
Intrauterine
to the IUCD.
Okay. IUCD. Okay.
Yes, intrauterine contraceptive device. Inti way so a plastic. Okay. And na newo hono ayese dade ne copper.
Okay.
So copper like near the yasuma no your friend copper but it's actually copper.
Okay.
All right. So we all know say copper doesn't rust. So this one can be used for 10 to 12 years.
Okay.
10 to 12 years. Neshaho.
Enti eno so ye de share insa and I say which parts of the body? Okay.
So that's why it's called intrauterine.
Enti meaning say eno no mobeye nipa ne surgery and I say mubetwa nipa na wo de I mean how do you do that?
So when
okay, it's metallic.
Yes, that's the copper.
Okay. Wow.
That's the copper. So it's not like exactly metal, it's just the copper.
Okay.
So when you shemawa, the two are woody, it's not through a surgery. Last no be by or person share IUD. No, in fact, it's not your per implant. But she had a medical condition and IUD was the best option for her. Also, was true because what to say is shy, you are woody no.
We will come back to the fears.
Oh yes, you are woody and APA near the atom. But so it's one of the in Sama Kafa IUD no especially. So IUD initially very simple.
Okay.
Very simple. Yeah, the fawase edidu awudi. Yes, and it's not painful. No, it's not painful.
Okay.
So, on say, so what on Sasha was here. So bad in Sasha Nasia, Nensa Pim bibi ewo nase as an no pobino, and no ne a woody and no.
Okay.
Aha. And no money the fa edidu awudi. So I would an there. Talk what the ma echo a woody straight. So honey the fa. Okay. And way get away any edit too. Mensa and to me ra wase inkura wa woody. So it comes with this own tube, say some small tube like BBI insertion and no see a plastic.
Okay.
Any idea insertion. Into also and a baby room I could do a woody ni jarden at all.
Okay. Into I know you for 12 years.
12 years.
And more.
Yes. Into when you say no, unlike Niamabo bosu no way a drobiani.
Come again.
So pills no edro injection edro implants edro IUD edrobiani.
Okay.
It's just the copper. IUD edrobiani.
I mean it is strange how copper can prevent you from
naturally the sperms sort of react to the copper.
Okay.
That the woman's body doesn't.
Okay.
inti na yetumi de way eto awude nim no. So say after inhyiamu no bema no husuo ni begu awude nim a because of the presence of the copper ewa awude nim ninti no omuntumi survive ewa awude nim.
Okay. Enti apart enti no sesiano your pills, injection, implant, any IUCD. I can still see say quite enyoma baku mienu bi egu wenim ho. But before that no mimbie phone lines no senye ahwefo emrepemu no wonom ebetumi afre. Ubetumi afre 025-625-3461 anam 053-835-0625. We are discussing family planning. We've talked about the natural types of family planning and the artificial types of family planning. Stay tuned, don't change the channel. We'll be back very soon to continue.
Meye mi fie Christian fie Mema mi kun aye Christiani Na me mofra aye Christian fo Mema mi fie aye Christian fie Ban papam aye dwumadi a ekoso ewo WTV so Ekasa afa ekwan a ye tete ye mofra Ekwan a yebefa so ama yaware ayefe ne yaware edimu efie entete anase efie siesie ene efie nkomodie mu nso yenya entwenten entume to nsa frɛw sɛ hwɛ WTV na nneɛma pa bebree ɛwɔ WTV so enwumpa nkomodie papa nneɛma pa ɛbɛboa me ne omienu ene yɛmfie kɔso ara na hwɛ WTV.
It's been 60 plus 3 years of autonomy, 60 plus 3 years of revival and renewal with formidable growth. It's been 63 years of celebrating the birth of Ghana Methodism. Under the auspices of the Heritage Directorate, we bring you the 63rd Autonomy Week celebration from Sunday, July 21st to Sunday, July 28, 2024. Series of activities have been outlined for the celebration in all societies across the connection. Sunday, the 21st of July 2024 is the launch and opening of exhibition. Monday, 22nd July is a memorial service. Tuesday, 23rd July is a talk on the history of Methodist Church Ghana. Wednesday, the 24th of July is an inter-class quiz competition. Thursday, 25th July, Organizational Music Festival. Friday, the 20th of July, Autonomy Prayer Meeting for the Methodist Church Ghana in all societies. Saturday, 27th July, is Society Evangelism Program and tour trip to Diocesan Heritage Site. Sunday, the 28th day of July 2024, is the Autonomy Thanksgiving Service together with a flag raising ceremony at all the diocesan cathedrals. It's the 63rd Autonomy Week celebration. Let's join hands with the Heritage Directorate as we celebrate the commemoration of the day when the Methodist Church Ghana was granted a fully fledged conference status by the British Methodist Church in 1961. It's Autonomy Week celebration. Look out for the 60+3 Autonomy special chocolate to support our heritage site. This advert is powered by Communications and Publications Directorate.
Welcome back. We are discussing family planning. Our phone lines are opened and we already have others waiting on the line. And so we have Christopher. Hello, Christopher. Good evening. Ufe free and crying here.
Yes.
Yeah, Tio Christopher.
I want to find out about the implants. When she was giving the education, her microphone went off, so I didn't really hear what is done to that part of the skin before the implant is done for the person not to feel the pains.
Okay. So she will explain that. Hello, Fireman. Good evening.
Oh, my love. How are you doing?
Fine, thank you, Fireman.
You are looking so fantastic this evening.
Thank you, Fireman.
Attempt to grab a better mechanic here.
Okay.
Topic I'm treating here, and you're by special, and that's why you're more what to go any book. Yet to me, you say rock, seven, Yansa daily. Udon pack na yawo. Within seconds, I can with you. It to me, no, family planning is very important to everyone.
Okay.
Nipedia unima. When him say, if you are 9 months later, ubewu. If after 9 months, you know who we are. Now we're planning the if 2 years to come. No, let's have vanity. But to be one more plan, yeah, to now I will. If there's another deep in Colano, it be messy. And I too, so let's see family planning. Planning one. Let's see our infection.
Okay.
Into the messy part, more educating was I don't know.
Okay.
And I'm being so open in natural way. No, natural way. So one said, "You are not can use your bano." Then we should tell me we are back. The condom. Condom is so man so pet. It's a bed. It's
Okay, Fairman, yate you bet too. Sheila is on the line. Hello, Sheila. Ufe free Fadama. Me pacho yetio.
Pacho me for family planning 3 months in. I'm pacho me and therefore I am the ministry limit.
Hello, Sheila. Me pacho ubetumi repeat your question ni biom ye shada ante unkan ye papa.
Pacho yo me say. Me for year family planning it last week.
Okay.
After me we me I am me any many so
Okay. Inti sister ewa ha obeyi ano ama. Ye nko kaswa. Hello, nane free ye ufe free kaswa.
Me pacho. Me pesa me busa. Get me a banana.
Mpacha say.
Me pesa busa say. Jama be na planning.
Bisa say be ma betumi aye family planning ana.
Pacha.
Me pacho you owa hanti obeyi ano ama. Kobi and so free wager. Hello, Kobi.
David.
Kobi, good evening, ye too.
Family plan here, this is yourself. My wife, actually, is about 7 or 8 years.
Okay.
Now, and I'm very fine now, which me agree.
Hello, Kobi. Me pacha wo say o wife dear yadesha ensa ho no
and advice 7 or 8 years.
7 or 8 years ni aha.
Njin kan pese wo yi na baby se bia so ba utumi awu fufura na se.
Okay, bisa say obetumi eyi so because o pese wo sign ewo fufuro ana.
Oh yes, of course.
Okay. Thank you. Enti there's another caller from 𝗟𝗓𝗩𝗘𝗂𝗪 where the Miami Chrome. Hello, good evening.
Good evening, madam.
Me pacho yetio.
Me pacho. My family planning for 3 months, but my menses emba.
Okay, why a family planning for 3 months, but all menses emba?
Pacha.
Okay, sister wahainti obeyi ano amao.
Yeah, okay.
Hello, Isaac. Ufe free Spentex. Isaac, yetio.
Family planning no me say natural one no man tinite.
Okay, upe say yen sanso explaining the natural ones ni bio.
Natural one because
okay.
Me the two na makan.
Okay, me pacho you enti ye be sign e repeat amount. Okay. So, Sister Frederica, now these are what our viewers and our callers are asking. And Yabeshe Ase Efri, the first question here.
Okay. So first person say when I was talking about the implants, no one thing about the pain. Okay. So implants, no me say the share directly under the skin.
Okay.
And yeah, the share inside her. So it's not obvious. And I know say the share just out of Osaka and son I'll be feeling say a show. Yeah, the share yen tra or banensa and fan too. The implant no comes in its own special kind of needle. A dishe. Needle no is just a little bigger than normal one. I the wapane way to because it's something to accommodate this. Inti answer na yede besha ni ye what injection e wo baby a ye besha ade no.
Okay.
Inti it's a form of anesthesia. Ebema ohonewu. Inti ye de sha until
you won't feel pain. Okay.
No. She won't feel anything. Yeah, we are. Then we'll just plaster the place fine. But at the end of the day, we are enye bibia ebe crow and I say ebe just scabi. No. It's just a small needle that we are using to do the insertion.
Okay. Inti me jidi ye say what say. Inti the next person. So now on also a bisa another question there. I don't know if you have.
So the second person or friend was talking about say injectables injections and cough can say my infection. It's not true.
It's not true.
Injection ain't me my infection.
Okay.
Say side effects no per can. That one day, yes, everything has side effects. Okay. And also one side effect as soon you be experience, but it is not an infection. And side effects no oba ansana yebema any of them ni explain it show.
Okay.
Explain the side effects are now for you to understand answer way. So injection name my main answer lady no say on your menses no. It is part of the side effect. I'm surprised that baby or call you no man or man can't train no. But a side effect nibi and it is because of how it works. It is very normal.
Okay.
It is very, very normal. So
okay, we will come back to the effect, but let's pick our last two calls. Then we can answer all those questions. Okay. Hello, good evening, Georgina.
Hello, good evening, madam.
Mpacho yetio.
Mpacho me kampese me bisa say. Me pesa kampisa say family planning. The one kasa wo fie no. No, madam, Chim say, be a winner menses first day now. A free first day, no copy 7 days, you know, and only bear my share when you. If I send me who's a date near one fin and bear my share, if I send me who.
Okay, so I think okay, see, me pacho sister ewaha obe explaining amao.
And I say natural.
Enti yenko takrade embra. Our final caller, Uncle James. Hello, Uncle James. Ufre free takrade. Good evening. Pacho yetio.
Good evening.
Good evening, Uncle James. Yetio.
Pacho, mu program kakran be. Why fire family plan 3 months there 4 years.
Okay.
Mu program kakran be. Why a family plan there about 4 years now. On 3 months on your message. Oh, hold it with that chance. Because 4 years now, why a them 3 months family planning on your message? I am sharing here. That's the worker or no problem.
Okay. Are you Ointi sister ewaha obeyi ano amao. Okay. So unfortunately yen to me answer calls nibium but questions kakra ye wo ewaha no sister ebeyi ano amayen.
Okay. Inti minka menses no wasam ne fa ne aka
yes.
Okay. Inti injection implants obi betumi aye injection and asa implant especially the 3 months injection and a implant in the mubia on menses.
Okay.
And they're very normal. Very normal So enye bibia ebeha oba no in any way anase ebema wenya yare bi ewo baby. So yaka the way a edroni sifaye ejuma ni nti na menses ne emba no.
Okay.
Nti naturally e was say bosumi bia wotu nkosua. When yin say ya obeye menses. De bia me de we e tra se kakra wo. Ye fa ne say wo fie no bia fra wo so meba besra meba beda ho. You have a guest room. Nti so npa ko na ka se meba beda. Obesi guest room ho.
Okay.
Good. Inti inkosua na to no hoho na wakra wo se oba no.
Okay.
Body no decide say inkosua to a wo se yesiesie inkosua n'echi. Ebia na nyinsan aba. Inti esiesie awudi enim.
Okay.
Inti esiesie awudi enim moja bebre begu awudi enim. Ema awudi enim soft. Tough. So na be say akola bi ba obenya very comfortable space abeda.
Okay.
Okay. Inti wo ho ne friend say, "Oh, me sorry me nya anda." And I say be oba ye no, osan ko ye wanda. Baby a ukosiesie na woto mpa de nyama gugu o be say yi wa de nyina efi o asan bobo ahye wedokuma na mebo a. Aha, because we nya anda.
Yeah.
Yo, inti nkosia na eto ye no, akola bi amba. Inti akola bi amba de a e wo say ahosiesie na ekọ so awode enim ebesin
ko.
Inti eno na moja na ebegu awode enim ebeba abesin obehu say why your menses. Inti sana naturally body no eye nejuma sifa.
But this is the situation whereby the person is not menstruating.
So I'm going to come to that. Inti se wo ye family planning na, the main purpose of family planning is that wunyinsen. Inti se wunyinsen a nia ebema nyinsen na ba no free ho.
Okay.
Inti na che se wo betu nkosua na wo de be nyinsen dia ene nkosua na entokra. Se na be ya se wo ye sex a untumi nyinsen bia entumi ba because ye nkosua na free ho. Okay. Se nkosua na anto a then it means naturally the way anka body ni be siesie awudi enim atwen akola no ho enkoba mfa so because nkosua bia anto.
Okay.
Oh, hobi anfra se me besra o. Obi anto nkra. Unsori nkosiesie guest room nto ho. What you say? Aha. Enti se nkosua nto ya body ni siesie no. Enti na che se moja emba awudi enim. Inti busu me ne beso no moja bi eni awudi enim ebeba besin.
Okay, inti no omo a they are not menstruating as a result of the family planning no.
It means they are not ovulating.
They are not ovulating.
Exactly.
Okay. I feel now, Matthias, because I was even about to ask you, say, but say, Debiano, yakase, if say, Nipano one menstruates, mojano, the fibroid, ninyama ebebana.
So, it is one of the unfortunate misconceptions that people have. Say, one year menses are mojafi na wase epie na emba menses na enye mojafi eye moja begu awude nim esiesi awude nim twen akola sa akola na mba e na ebesin entenya awude ne na ewuru ni mu na yakase efi ne begina awude nim anase mojafi ne begina awude nim enti say oba anye menses are there's nothing to fear. You didn't ovulate.
Thank you for enlightening me, especially. Enti mo amoshe ewo fie we de sister Frederica wa churchim or say why your family planning na say bosome ason na say umbu wonsaya. There's no cause for alarm because body no because of family planning means no kosie bia ento intino moje bia eni honoma e wo say ebesin eko ana. That is it. Okay. Enti yewo quite some few questions being so ewo ahase obi ebisa say please if I may ask, if you want to get pregnant, what will you do to get pregnant? And another question is, please, I just finished my period yesterday and I had unprotected sex today. Can I get pregnant?
It's not likely, but it also depends on the cycle.
Okay.
And the one who is trying to get pregnant, say if it is something they've been trying for a long time, they should come to the hospital.
Okay. Okay. Inti, whoever sent this message, no, Sister Frederica say it's advisable say Obeba Hospital. We still have I think one or two in
more.
the year.
Yes, inti Bakose Okowo Depot just about last week and onya headaches, dizziness.
Yes.
And Pacho, it's all part of the side effects.
Okay.
It's all part of the one of fufro.
Okay.
As any I was starting you so fufro, definitely you will have some effects. But after a while, it will pass.
Okay.
Okay. It is something that you experience the first few days or first few weeks where you have started using it.
But is it advisable say obey take like medications?
Oh, for headaches.
For the headaches.
Yes,
okay.
for headaches, obey to me taking medication. Dizziness is not expected to be anything serious unless she's getting so dizzy that fainty, and then she has to go back to the hospital. Okay,
I understand that a lot of people are calling, a lot of people are sending in messages, but we want to apologize. Say but yeah, promises say yeah, Sister Frederica ebe sign so ababium amaya tia and so auntie, look out for her WTV consulting room. So yeah, you were singing something in relation to that. Yeah.
Yes. So the side effects needed to something that will go away eventually. Okay. And near also the wife I share family planning for 7 to 8 years. Ashawache. It's not supposed to be for that long. Into onkoyi.
Okay.
Okay. And okoyi obet me you say into onkoyi.
Okay. Yeah, that's Sister Frederica. Today we have been discussing family planning. I say still now we have a lot to discuss, but senye ya promise no Sister Frederica ebe sign so aba amaya tua and komo chichen. So because I can see this is a topic of interest. I have been enlightened. Mesia enyoma bako mienu miensambi. Entino aha ena emre ebe makwama yede and komo chichen esi. Yes, about what the natural family planning is. That is natural family planning. Obi ekase nanka yen bomu kakra entreno eno nyina and say you
knowing your cycle.
You knowing your cycle.
Knowing when you are safe and when you are not safe.
Okay.
Yeah.
You knowing your cycle, knowing when you are safe to have sex. And when you are not safe to have sex. Yes. Okay. And I think so try and say artificial family planning no. Your pills, your injections, your implants, your IUCD. Your condom and so but no raining to know to me anka ho asem. And there's another one too in a pink sachet on the table. Female condom, okay. Entino emrepemuno obesan bana yatoa enkomo twetwe no. So midin the Rachel Mercy ahena yen Sister Rose Aduful ne ho dodo ne kakra enti na ende e was say me betni mu emano. And so we are wishing you a speedy recovery also for Rose Aduful. Speedy recovery from me and the viewers and all the crew here. Yeah, bo empire say Yakopon ebemawo ahoden. And also from Sister Frederica, or say always show speedy recovery into aha NIA and that WTV consulting room no ABC. Me say WTV consulting room is the only free consulting room you can get here on planet Earth. So we'll see you same time again next week. Enjoy the rest of our programs. Mene Sister Frederica Crunchy or a senior midwife reproductive health unit at 𝗟𝗪𝗡𝗏 Teaching Hospital. Meneno and I end there. Enjoy the rest of our programs. Bye bye.